If you're turning 65 or reviewing your Medicare coverage in 2026, it's important to choose the right plan. You don't want to have to spend tens of thousands of dollars that you didn't have to. Medicare supplemental plans are standardized, but the rate increases, the initial price, the changes over time with the pricing, the stability, those things are not standardized, and they differ carrier to carrier. Following outdated advice could cause you to spend thousands of dollars in excess of what you need to, or worse off, you could be unable to change your plan due to your health at a later date. So let's get into what we view as the top 3 Medicare supplemental plan choices. Okay, so with Part A, Part A, again, this covers inpatient care, right? So inpatient care and skilled nursing. We'll go over what the coinsurance and cost sharing is for the insured person here. So there's a Part A per admission deductible. So this per admission deductible is important to recognize because it's per admission. It could be if you have hospital stays separated by 60 days or more, you're going to end up paying that on a per admission basis. There's no cap on what your expense could be for those hospital stays. Okay. Now, in addition to that per admission deductible, you also do have a copay. So once you've been an inpatient for 60 days, you're going to owe $434 a day starting on the 61st day. Once you used up to 90 days of lifetime care, then you're going to pay an $838 deductible each day. Okay. That's again, if you just have Medicare Part A. The other service that Part A covers is skilled nursing. So oftentimes people may need skilled nursing care if they have an inpatient hospital stay lasting at least 3 days. You're transitioned to a rehabilitation center like a skilled nursing center. First 20 days, there's no cost. That's zero. And then days 21 through 100, you'd pay a $217 per day copay for the skilled nursing. Once you've exceeded that 100 days, you're responsible for all costs because original Medicare only covers the first 100 days of skilled nursing. Okay, so Part B. So again, this is the other part of original Medicare, how the coverage works if you just had original Medicare. So you have a Part B deductible. So the Part B coverage is for outpatient expenses and physician services. So you're going to pay the first $283 of the cost. Once you satisfy that $283 Part B deductible, then you're responsible for 20% after that. There's no cap on what that 20% could be. So there are certain situations where that could become excessive, expensive surgeries, cancer treatments. So let's go through an example. If there was a $100,000 bill, let's say, and it's a Medicare approved amount, Medicare is going to pay 80%. You could owe $20,000 to 20% of the $100,000, especially if it's a very expensive treatment like chemotherapy, right? That tends to be quite expensive, especially if you're receiving these treatments via infusion, which will fall into that Part B drug coverage under the Part B. Okay, and again, a couple of things to know with Medicare supplemental plans. You can go to any doctor, hospital in the country that takes Medicare, right? So there's no network. You don't have to ask your doctor, well, do you take Aetna? Do you take Blue Cross? Because no matter what supplemental plan you have, if the doctor takes original Medicare, that supplemental plan is going to pay off that Medicare schedule of approved benefits, right? Now, all these supplemental plan offerings are standardized. So what that means, every company that offers Plan A, Plan B, Plan C, F, N, whatever it is, it's the exact same coverage. So you have like an Aetna N versus a Humana Plan N. The coverage is exactly the same. But again, where these companies differ is the initial price, but more importantly is how they raise rates over time, the rate stability of the carriers. So you want to look for things like risk pool, like how many people are enrolled in the plan? How long has the carrier been in this state? Is their enrollment population growing? These plans tend to be more stable, right? Because there's more people to spread that risk across. It's a bigger pool. Usually when you have a brand new carrier to the area, or a carrier that's offering Medicare supplemental plans for the first time, they'll come in with the lowest price because they want to hit their enrollment number. They hit their enrollment number, and guess what happens in subsequent years? They raise the price higher than the average, right? So you want to stay away from carriers that are relatively new to the market, usually carriers that, have been offering a plan for a year or two. So let's get into some of these Medicare supplemental plans, right? Some of the letters. So this standardized letter set, A, B, C, F, G, K, L, M, N. Okay, the A, the core package plan, that's like every carrier must offer this plan. Okay, now a lot of times you're not going to choose that plan because they have, high coinsurance, which we will touch on. Okay, and then, plans F, G, and N. We'll talk about F and MACRA and what that means as far as new enrollees enrolling in Plan F. So only folks that have had Medicare, have been on Medicare, or been Medicare eligible since January 1st, 2020. If it was before that date, then you can enroll in plans F and C. But, the CMS, the governing body of Medicare, they want folks to share in the cost. So those plans that didn't have a Part B deductible, they're no longer allowing new enrollees to enroll in those plans. Okay. So again, this is kinds of touches on plan C and F, right? And what that means. So new enrollees are closed because there was no Part B deductible. There was more first dollar coverage. So what that means for folks that are in those plans, it's a shrinking risk pool. So in theory, costs are going to go up over time. You don't have new people entering into that risk pool, right? So you don't have any healthy younger enrollees to spread that risk across. Okay, so if you are somebody that may be enrolled in the plan C or F, it is a good idea to, and if you can get underwritten, like if you're healthy enough to get approved by another carrier like a G or an N, it's probably a good idea. The savings over time would be substantial. Okay, so high deductible plans F and G, again, plan F and G, they have a higher annual deductible, right? So it's typically for healthier people. Again, so you're going to have a deductible of, like in 2026, it's $2,950 on the high deductible G, right? So it's for people that want a lower premium, have less medical expenses, and they feel relatively healthy. They're kind of betting that the premium savings over time will offset any potential out-of-pocket costs that they could experience as well. Okay, so A and B, these are limited coverage. They have kind of major gaps. So you can kind of disqualify these. It's very rare that somebody enrolls in these plans. K and L, they kind of have complicated cost-sharing structures, cost-sharing percentages, higher out-of-pocket maximums, okay? There are certain states that, if you're not in these states, you don't have to worry about this, but there are certain states that don't use this grid. They have standardized Medigap plan designs, right? So that brings us to really the top three consistent choices for Medicare supplemental plans: Plan G, Plan N, and then the high deductible G. Okay, we'll get into some of the differences between these. Okay, so Plan G, this plan offers predictability, right? So predictability in your known out-of-pocket expenses, because you're really just going to have that $283 Part B deductible each year. Once you satisfy that Part B deductible, there's no out-of-pocket expenses after that. Obviously for Medicare approved services, no copays, no coinsurance. This thing about excess charges, this tends to be overblown a little bit in my opinion. So an excess charge is if you go to a doctor that didn't accept Medicare assignment, that doctor can bill in excess of 15% of what Medicare would pay. So let's say you just had original Medicare, the doctor bills 115, Medicare pays 100. You have your cost sharing plus that extra $15. But with the Plan G, it covers excess. Now there are 8 states which can't bill excess. They passed this Medicare overcharge measure. So those are states like Pennsylvania, Ohio, Connecticut. There's another 5 of them. They're Northeast states, typically. Okay, so again, this is best for people that want security, that want, fixed cost. They know what their premium is going to be every month. They know they're going to have their Part B deductible, and then that's it for their cost per year. Now, typically with the Plan G, compared to these other choices, we've seen the last 5 to 7 years, the rates do go up by a higher percentage than these other options, because typically folks that are enrolling in the Plan G, they tend to use care more, right? So if you have a pool of people that have higher usage, in theory, the rates are going to increase by higher percentages over time, right? Okay, so the Plan N, it's a very popular choice, especially, if you're somebody that, you want the lower premium, you're okay with paying a copay at the doctor. So this copay exists after the Part B deductible. So I pay my $283 Part B deductible. Then I'm going to pay up to $20 at the doctor and $50 at the ER. Right now, the up to 20 is important because it's 20% or $20, whichever's lower. So usually with Medicare, the doctors are paid off of 4 different levels of complexity. So, I mean, if it's a low complexity visit, which obviously they try to bill higher levels of complexity because then they get paid more. But let's say the visit is $60, right? You pay 20% of the $60, it's $12 as opposed to the 20. So it's not always $20. Okay, so this Plan N is more stable. Over time, the rate increases have been lower comparative to Plan G. So the gap in premium will just grow over time. So it does take a lot of doctor visits to make up that difference. I mean, you're usually looking at the 20 to 30 visit range per year to get close to making up the premium difference between the two. Plan N does not cover excess charges. We get into that in another video. But again, if the doctor takes Medicare, you're not going to have to worry about excess. And then if you're in one of those 8 states that do not bill or cannot bill excess, again, it becomes a non-issue. 98% of doctors take Medicare. I mean, you'll find pediatricians that don't take Medicare, or, because obviously they don't have a lot of patients on Medicare. Some kids can be on Medicare through, or I would say adult dependents, through Social Security, disability, and things like that. But it's rare. So you may see pediatricians that just don't take Medicare, right? But the majority of geriatric physicians, family physicians, they're going to take Medicare. It's very hard to find one that does not. So again, that Part B access is not as big of a deal with the Plan N. Okay, so high deductible G. Typically, like, just to give you this example of premiums, let's say Plan G right now, $170, just an average, right? It's going to differ based on your location, your area. Plan N, let's say $125. And then high deductible G, like typically you're looking at $30 to $60 a month. So it's quite a bit less, right? Now you do have that annual deductible. That's at $29.50. The way that works is, like, if you have an inpatient stay, you're subject to that deductible. If you have a Part B covered service, you're going to have your Part B deductible plus the 20% until you hit that overall deductible of that $29.50. Okay, so if you're saving $1,200 a year, if you hit it every 2 years, you're breaking even. But the average person doesn't go to the hospital that frequently. It's way less than that. I mean, the average senior might be one every 4 to 5 years. Obviously, the younger you are, the less likely that is. So it's for people that, they typically, they just look at math, right, when they're picking insurance plans. So people that use regular Plan G, the standard Plan G, people that want peace of mind, they're not as concerned about the math. They're more concerned about, hey, I just want to, if I know that the most I'm going to pay is $283, then I can sleep at night, right? Everybody looks at insurance different ways. High deductible G, those are for folks that want to take on more risks, but they're healthy, so they can justify the premium savings. And they also may look at, like, hey, these high deductible G, historically, the rate increases have been lower year over year. So it's something to consider if you fall into that category, right? So Again, bad medical year could mean paying that full deductible, but it would really have to be an inpatient stay, right? That's the likelihood that you're going to have that. Okay. So just to kind of review here, what to decide, what plan to pick, and all that stuff. Again, a lot of it comes down to how you look at insurance. Like if you look at the math, or if you look at the peace of mind. Typically, if in the other thing to keep in mind too is if you're new to Medicare and you do have some health concerns where you may not be able to change your plan going forward because of your health, like if you have a neurodegenerative disease, neurological condition that is always going to be present and increases your morbidity risk. Again, those are things that if you try to switch down the road, you would be underwritten, most likely wouldn't get approved. Typically, I'll recommend people pick Plan N that are in that situation. Because if you look at the difference between N and G over time and you apply the rate increases, it's tough to lose out by going with Plan N. I mean, you'd have to go to the doctor an awful lot, which we have another video with a rate analysis that kind of goes over that difference as well. You can check that out here. So that's Plan N. And again, high deductible G, if you want to take on more risk, you're healthy, you want a much lower premium, high deductible G may be for you. And then standard plan G, again, if you want peace of mind with any of these plans, again, the important thing to remember is there's no network, right? So you can see any doctor or hospital in the country that takes Medicare, whether that's MD Anderson in Texas, Sloan Kettering in New York, Cleveland Clinic, any of those health systems. So typically you're choosing a Medicare supplement plan to begin with because you want to be able to choose your doctor. You want to be able to see any doctor you feel could treat you the best if something happens, right? So typically people will lean towards Medicare supplemental plans that fall into that camp. So again, these are just things to consider as you're entering into Medicare. The first decision, I would say, is the most important decision, right? So thanks for tuning in. Again, you can check that other video out right here.